Hi there, my name is Alistair and I'm a nurse here at Marquette University. I want to talk with you a little bit about fetal heart rate tracing. In particular, I want to define what a category 3 fetal heart rate tracing is. I want to explain why they're significant, and I also want to educate you a little bit about some interventions that we may take if in fact we do come across a category 3 intervention. So to begin with, what is a category 3 determination? So in order for it to occur, two main criteria have to be met, but some of those criteria have sub-criteria underneath it. So the first criteria that has to be met is there must be absent variability along with one of the following: either recurrent late decelerations, recurrent variable decelerations, and or bradycardia. The second criteria that must be met is the tracing must be a sinusoidal pattern. What's an absent variability? Absent variability means there's no irregular waves or fluctuations in the baseline fetal heart rate of 2 cycles per minute or more. So typically we want to see variability within the fetal heart rate because it indicates normal fetal acid-base balance. So when we don't see that variability, that should already be a cause for concern and further evaluation or investigation. Along with the absent variability, one of the 3 following must occur. So recurrent late decelerations, recurrent variable decelerations, and or bradycardia. So what's a recurrent late deceleration? Well, to begin with, it's recurrent decreases and subsequent returns to baseline in fetal heart rate. In order for it to be considered a late deceleration, though, the deceleration must begin after the uterine contraction has started. The lowest point of the deceleration must occur after the peak of the uterine contraction, and the return to baseline of the fetal heart rate must occur after the contraction is over. So if there's recurrent late decelerations, that's one of the subsets. The next subcriteria that can accompany the absent variability is recurrent variable decelerations. So variable decelerations are abrupt decreases in fetal heart rate below baseline. The drop must be at least 15 beats per minute for at least 15 seconds, and it also must return to baseline within 2 minutes in order for it to be considered a variable deceleration. When you're looking at them on a fetal heart rate tracing, it will often appear as a U, a V, or a W. That's what a variable deceleration is. So we would see recurrent variable decelerations in this case. And the other sub-criteria that can be met is bradycardia. Bradycardia in this instance is defined as a fetal heart rate of less than 110 beats per minute for at least 10 minutes. So, like I said, in order to meet the first criteria, there must be absent variability along with either recurrent late decelerations, recurrent variable decelerations, and or bradycardia. That would meet the criteria for the first criteria. The second criterion that must be met is there must be a sinusoidal pattern. On a fetal heart rate tracing, the sinusoidal pattern will appear to be a seesaw pattern on the tracing. This can occur for a number of different reasons, often due to severe fetal anemia, but it can also occur due to a chorioamnionitis, fetal sepsis, and administration of opioid analgesics. So just to go back one more time, in order for it to be defined as a category 3 fetal heart rate tracing, you must have the absent variability accompanied by either the recurrent late decelerations, recurrent variable decelerations, or bradycardia, and you must have the sinusoidal pattern. If we come across a category 3 tracing, that requires immediate evaluation and prompt intervention. The reason why is because it's indicative of oxygenation disruption to the fetus, which can lead to hypoxia and hypoxemia as well. Some interventions that we may implement when we come across category 3 include increasing IV fluids or giving a fluid bolus, repositioning the patient, preferably on the left side lying side. But if the patient's already on the left side lying side, we may actually place her on the right side lying to see if that helps improve the fetal heart rate. We may give the patient oxygen at 10 liters per minute through a non-rebreather mask. If the patient is being administered Pitocin, we may discontinue the administration. And we may also give what's called an amnioinfusion, which is where you increase the volume of fluid within the amniotic sac. What's important about the interventions, though, is upon finding of the category 3 fetal heart rate tracing, we're going to let the provider know so that the interventions can be ordered. Like I said, the most important thing is once these are identified, we need to have immediate evaluation and prompt intervention because it is indicative of some sort of oxygen disruption. If you have any questions, please feel free to reach out to me because I want to make sure that you understand this really well so that you can identify it if you see a fetal heart rate tracing. Thank you and good luck on your new career.